Hi everyone, sorry for that brief trying to figure out what the heck I was doing. Okay, so this is my language cultural content presentation. My name is Karishma and hope you enjoy. So how I spent my time, I am a medical scribe in the ER. Sometimes we get Spanish patients and because of this we need hospital interpreters. They are Spanish translators. They communicate with the patients actually, and then translate back to the doctor and myself. And I take notes on these patients' histories and all their information. So my shifts are usually about 9 to 10 hours, and I've spent approximately 2 hours with two specific patients. The next 2 hours I did on the CDC website on a more taboo subject, on sexual health and more specifically STDs. So to begin, my two patients that were involved were Baby Boy Doe and Jane Doe. I can't give out their names just for liability reasons. I'm sure most of us are in this class because we want to go into healthcare, so we all know about HIPAA. So the first boy, the patient that I had, Baby Boy Doe, he actually came from Mexico with his family, and he was being tested for meningitis, which was pretty interesting. That's actually something that's really common here, but I guess it was not very common in Mexico, so they sent them here to get tested further. The next patient that I had was Jane Doe. She just came in for abdominal pain, vomiting, and I basically chose to talk about these two more specifically because one was more serious and the second one was more common, yet they both were completely in Spanish, and it was interesting to see what they had to say. So to begin, Baby Boy Doe, basically, to give a short story, I didn't really write this down, but just for us to understand, he came in with his family, his mom and his grandpa. They came in from Mexico. They drove to our emergency department. They came in with blood work and lab work, basically. And I basically went off of the sheets that they had and kind of translated and tried to see what exactly was different from his paperwork and lab work versus ours. And I found some interesting vocabulary. So one of them was blood work, which was análisis de sangre. And then they tested for white blood cell count and red blood cell count. These are a little bit out of order. I just wrote down what I saw. So white blood cell count was recuento de glóbulos blancos. And then for red blood cell, it was recuento de glóbulos rojos. So both of them, the same thing, just the colors changed. And, blanco we know is white and rojo we know is red. So it was kind of interesting that those were the same. And then these two were cognates, cholesterol and meningitis. So meningitis literally was the same word. So those two were interesting to see. And then the vocabulary for Jane Doe was a little bit, they definitely had more cognates. So vomitos, nausea, and diarrhea for vomiting, nausea, diarrhea. And then dolor de cabeza, which was, basically head pain, headache. Then dolor pelvico, which was pelvic pain, and dolor de sinusitis, which is sinus pain. The pelvico and sinusitis was also cognates, and this was more easier to understand than the meningitis one. Even though we had a Spanish translator, I was trying to see, as I always do and before I took this class, to see if I could understand exactly what the patients were saying, just based off their hand gestures, their movements, kind of reading their charts. So the cultural nuances for the hospital, the paperwork from Mexico was interesting. I can't specifically explain it, except for the fact that the paperwork that we have usually comes in, it seems more organized from what we have. I'm not sure, maybe if I just didn't understand completely in Spanish, all the paperwork or what, but their paperwork, or if it was just a specific hospital, but the paperwork was very unorganized. It was hard for even the interpreter to translate it. So again, I'm not sure if that's just because it was from Mexico specifically or what, or a hospital specifically in Mexico, excuse me. But that was kind of interesting. The other thing is it was really hard for the family of the baby boy Doe to understand what meningitis was. I don't think they had really heard of it very much. Again, I'm not sure if that was just something specific for that family, but meningitis is a pretty common disease or sickness that we have here in America. So it was kind of interesting to see that they didn't really know what it really meant, and it was hard for them to understand what was going on. And the other thing is not really sure if this was necessarily a cultural nuance, but I thought it was because they were more comfortable with the Spanish translator. Even though, it was explained what my role was and who the doctor was and who the nurse was, just the fact that they were able to communicate better with the translator made them more comfortable, and they were more grateful, I could tell, towards the translator than they probably were to what we were doing as our jobs. And, that was just kind of interesting to see. Okay, so the next 2 hours, like I said, I spent on the CDC website and talked about sexual health. Did this totally on purpose because it's very uncomfortable for some people to talk about, to read about, and it's still a very, very important part of our health. Like STDs can cause a lot of damage, and sometimes it's not talked about very much because it is so taboo and it is very awkward for people. So I specifically chose chlamydia and gonorrhea because those are two very common STDs. So chlamydia is the cognate. Some new vocabulary that I learned was infección, another cognate. And then embarazo ectópico. So studying or being a scribe, I know what ectopic pregnancy is. We learned what pregnancy is as well in our vocabulary. Ectopic pregnancy is basically when there's a pregnancy out of the uterus. So that was ectopic is basically a cognate, and embarazo was something that we learned already, or embaraza. So that was easy to put together for me. And then this was something common that I found was in English, we say pelvic inflammatory disease. And so that is an acronym. PID is the acronym. Whereas on the Spanish page, it said EIP, which was Enfermedad Inflamatoria Pelvica. So not only is just the pronunciation different, but the acronym was completely different. So if a Spanish speaker, were just glimpsing and looking at the English page, they would probably be very confused because they would have no idea what PID means. And same for anybody that was looking at the Spanish page that's an English speaker. I had no idea what EIP was, and then when I looked and compared, I realized it's literally the same thing, but a completely different acronym. The nuances here were that the advertisement for the Spanish and English page were completely different. For the English page, it had the advertisement had people that were of different skin colors and ethnicities, whereas for the Spanish page, everybody was Hispanic. Everybody was, they were just Spanish. So it was very interesting that they had that. I did not check the other pages. They did have pages in other languages too. But it's possible that maybe they had the same type of thing, which was kind of interesting, that they took, it was like a general thing, whereas in Spanish they completely changed the ad and the people in it. The contact numbers were also less for the Spanish page. There were more available contacts for the English page. There was about, I want to say 4 for the English page and about like 2 for the Spanish. And there was an extra website that you could go to on the English page, and the Spanish page, they didn't even have that option. And then something that was interesting as well was on the English page, the heading was different. It said women under 25 and older with risk factors get tested every year. Or sorry, women under 25 and older women with risk factors get tested every year. And on the Spanish page, they didn't even have that on there at all, which was really, really weird because I don't see how that would change even if you were Hispanic or a Spanish speaker. That should be the same for everybody. And I don't know, that's kind of scary to me. That's a little misleading for someone who is, falls into that range, So they only had that on the English page. So now we have gonorrhea or gonorrhea. Another cognate vocabulary involved was latex, secreciones, and sida. So latex, again, was a cognate. And what I found was instead of saying discharge in the Spanish language, they say secreciones. I did not see that anywhere in our vocabulary that we have learned, so I thought that was new and different. And then again, for the acronym, SIDA is AIDS, but instead, the acronym is completely different. So, Síndrome de Inmunodeficiencia Adquirida. I always try to speak fast and then I slur my words, so excuse me. But yeah, so if someone were to look at the English page versus the Spanish page, they may not catch that. I think this one was a little bit more easier to catch, the SIDA, because of just, the mix-up of the letters. But still, it's not something that is the same, so I thought that was different. Nuances, again, were the change in the advertisements, except this time on the gonorrhea page, there was actually a picture of a a strain of gonorrhea on the English page versus on the Spanish page, they did not have that strain picture. So it was more like they had like a chemical like compound or something on the English page, and on the Spanish page that wasn't even there. So that was kind of different. And then again with the ethnicities, they were the same for the Spanish page, but on the English page, it was just a mix of races and ethnicities. Again, there were more links on the English page than there were the Spanish page. And then I noticed there was a bit of discrepancy in explaining the symptoms. There were more symptoms listed on the Spanish page than there were on the English page. And then for some information on the English page, there was more description there than there was on the Spanish page. So it wasn't exactly the same for the gonorrhea page, which was different. I'm not sure, maybe why they did that, if they explained it later else somewhere, but from what I was reading and when I spent my time, I did not see that. Not to say that they didn't cover everything, but there was just more on one page than on the other and vice versa. This was my reference, mainly the CDC page. Obviously, I can't have a reference for the hospital. I just work at Chandler Regional and Mercy Gilbert, and the hospital interpreter that I worked with was at Chandler Regional. So yeah, hope you guys enjoyed my presentation. Take care.